All right. So we're officially recording now. Okay. So I need to have everybody on camera. Here's who I can't see. Hawa. I can't see you. There you are. Jalaquana, I can't see you. Can I call you Jay? What do you refresh my memory?
Jay, please.
Jay. All right. I can barely see you. There's something in the way.
I'm sorry. I'm trying to pick up while I'm in class right now.
You're what?
I'm trying to like pick up around the house while I'm
Oh,
in class.
yeah, don't do that. You gotta just sit. Sit
Okay.
and sit and because think of this as an online or campus class. You go into class, you sit at your desk, and you participate. All right. So that's what we should be doing for online as well. Finding a place to sit, participate in class, not up and about. So, Jay, I still can't see you. I can't.
I'm
There you
sorry.
are. There you are. Perfect. Okay. Masuna, I can't see you. I can only see your forehead. Um, Patrick, hi. Kayleen,
Hello,
how are you, Patrick?
I'm doing good. How about you?
Good, good, good. Good to see you. Um, Kayleen, Kylene, you have me upside down, which is fine, but I can still see your face. Let's see. I get 2 pages here of students, so I want to make sure I can see everybody. Nobody's in the car, right? Nobody's in the car, right? Nobody's at work, right? We're all in a settled place somewhere at home, on campus, right? Okay. All right. So we do have a big, I'm not sure how to fix that. Oh, Kayleen, don't worry. Kylene, don't worry about it. As long as I can see your face sideways. Okay. All right. So, welcome to community. Welcome to community. There's some familiar faces, and lots of not familiar faces. So it looks like I have mostly all Essington, Port St. Lucie, and I have one J, you're Centerville, correct?
Yes, ma'am.
Okay. Josephine, where are you? Where's Josephine? I know you're here. I just have to find you. Maybe Josephine's not here. Okay. Anybody? Josephine Kaba? Is that a classmate of anybody's? No? Okay. All right. I'll locate her. All right. So welcome to community. Jay, I still can't see you. It's kind of blurry and there you are. Okay. There you are. So everybody knows we have to be on camera, right? For the whole time. You need to take a break, go to the bathroom, get something to drink. No problem. No problem. Just you don't need to send me a message in the chat. I'm Professor Marvel. I'm going to be teaching your community class this term. We have a double class, so this is 2 sections. So I think we have quite a bit of students, which is great. So the way today's going to work is I know that most of you are in PEDS and MedSurg too, right? So if you've already had a PEDS or MedSurg class, you've already seen the orientation PowerPoint, but I do have to go over it. Okay. And then after that, we will go into the modules and talk about how the class is set up. And I'll point out several things that I want you to be aware of. Okay. The first thing I want to do before, oh, there's Josephine. Okay. Josephine just came in. I got an email from Amanda. For those of you on your computer, will you please go in? I'm going to share my screen. would you guys please go in to your week 1 reading? I want to know, it would be on this, I believe it would be on the second page of your module. Okay. All right, so I'm sharing my screen. So I am here. Your first page is your overview and second page is your reading. Okay, I want to know if you can click on this chapter 1 PowerPoint and let me know if it comes up for you or if access is denied.
I printed mine out. I downloaded it and printed it out.
So you have access to it. Okay. Is anybody getting a access denied message?
No.
Okay. So Amanda, Jay, you got to come on camera. It's all blurry. I can't see you.
Well, what I was trying to do in the beginning was I was going under the blueprint part where it says you could download it and then it gave me access denied. So then I did go underneath the module under the reading and it did let me open it.
Oh,
I messaged
okay.
you back, but I don't think you saw it.
Oh, I
before
haven't
class.
seen it yet. Okay, great. All right, super. Okay, problem solved. All right, let's go through the orientation PowerPoint first. Actually, before we go through the orientation PowerPoint, I just want to ask a couple of general questions that I always do at the beginning. So, what have you heard about this class? Come on, I'm ready for whatever you're going to tell me.
Is
That
it
is
not just
difficult.
so much focused on just the nursing home and the hospitals, more out what's going on in the community, or
Okay.
maybe?
Okay. All right.
I-
What else have you heard?
I heard of,
Oh, sorry.
No, go ahead.
That the answer are more alike. You gotta be careful how you picking it.
Say that again.
Like the answer are more alike, like they look alike. So you gotta be careful how you pick them.
Are you talking about exams?
Yeah.
Okay. All right. Fair.
I heard like kind of harder because it's not specifically talking about certain body part. It's like the more wide spectrum, so it could be like anything.
Okay. All right. What else? That's it? That's all you've heard about the class? I don't have any nightmare scenarios?
Mm-hmm.
Oh, Charmaine, what's the nightmare scenario? Come on.
That is very difficult to stay focused on the subject.
Okay. Okay. Why do we think this? Okay, you guys are in your second to last term, right?
Yes.
Why do we think this class is strategically placed towards the end of your program?
Hospital settings.
Community settings.
Community
Give us
settings.
more
Okay.
option, like more things that we can do for being a nurse besides being in a hospital and how we help the public. Things like that.
Mhm,
So that we can function in any section, in
mhm.
any session that
Okay.
we're in.
Okay. Okay, we're getting there. Anything else? So think about it. I had one student two terms ago describe this as somebody needs to mute with all the background noise. Is a med-surg class in the community. Okay, so think about what you've been doing so far. All your experience has been pretty much in the hospital setting with regards to school, right? Your clinicals, sims, labs, right?
Mhm.
Think about when we have to move our care into the community. Okay, number one, your community client can be an infant all the way up to the elderly and everything in between. So who takes care of those clients? Community nurses. Yeah, community nurses, right? So if you think about it this way. Your client, think about your peds experience and knowledge. Think about your geriatrics. Think about your mental health, fundamentals, pharmacology. What else? Med surge. You need all that knowledge and all that skill to move into the community setting, because you could be taking care of literally anybody, any kind of client, right? So this class is designed for you to pull all your knowledge from all these other courses you've taken and apply that to the community client. Does that make sense? So if you think about the next gen format, you have been introduced to most of these concepts that we're going to be covering at some point during your other classes. Now we're going to build on those concepts and we're going to apply it to critical thinking. Okay, clinical judgment. Right? So some roles of if you're in community nursing, community public health, they're used interchangeably. Think of some of the roles, think of the roles that the community nurse has. Think of the umbrella. You could be a school nurse, which is where most of my experience came from in the last 20 years. A community nurse could be a school nurse. You could be in the schools taking care of the kids, right? You could be a home health nurse, going out and doing home visits for clients at any age. You could be a hospice nurse, taking care of the hospice clients in the community. You could be a corrections nurse, working in the correction system. You could be a occupational nurse, which is working in the work settings. Environmental nurse, working with the environmental risks within the community. What else? Faith. You could be a faith community nurse, working within certain congregations within your community. Think about where you live now. Your first discussion question asked, pick a vulnerable population in your community and answer a few questions about that. Think of how does your community function? How do all these people that are leaving the hospital that need follow-up care, how do they get that? What settings do they get that in? Community settings could be anything outside the hospital. So your schools, your workplace, your medical office buildings, your long-term care facilities, your rehab facilities, your mental health facilities. Those are all community settings. Make sense? So we're going to be taking all this wealth of knowledge that you've learned over the last year and a half, and we're going to be applying it into taking care of clients in the community. I think it's actually you may never work as a community nurse, but you're certainly going to interact with community nursing. Right? Think about if you have kids in school. You yourselves have kids in school. You're interacting with the school nurse, who is a community nurse, a type of community nurse. Does that make sense? So this pulls everything together. This pulls all your classes, all your knowledge, all your clinical skills that you've learned so far, and now we're going to bring it out into the community. And if you look at your homepage, oh, hang on. Share my screen here. If you look at your homepage, here's the description of the class. If you haven't read it yet, It provides this course will provide a framework to support your practice in the community setting. Right? Now that you've demonstrated success and competence in knowledge and the skills to care for your patients, now we're going to start to incorporate this knowledge, your skills that you've learned, and the use of the nursing process, which is your ADPI, into your role as an LVN, right? Who's going to promote health, wellness to individuals and families in diverse community-based settings. Okay, so some of the things we're going to be introduced to within this course, right? How do we collaborate within the healthcare team? Let's say you're a community nurse and you work in home health and you're accepting patients that are being discharged home. How do you work with that? How do you collaborate with that healthcare team from the hospital to ensure a smooth transition home? Wellness promotion. Most of what we do as nurses is teaching. Okay, well, community nursing is full of teaching, full of education. We just talked about different providing healthcare in different environments out in the community, outpatient clinics, centers, schools, workplaces. Care the individuals with chronic illnesses. Chronic illness is a very, very common in the community setting. Caring with individuals diagnosed with HIV, vulnerable populations. Lots of vulnerable populations in the community setting. From homelessness, teen pregnancy, mental illness, substance abuse, human abuse and violence, elderly is considered a vulnerable population, children. Okay? So we are going to take our nursing process, apply our critical thinking skills and critical problem solving skills. We're going to take that all and move it from the hospital setting into a community setting so that we're able to provide safe, effective care to community members. Does that make sense? That's a bit of an overview. Okay. So our communities, as we know it, where we all live, whatever our zip codes are, we all have vulnerable populations that live within our community, do we not? And sometimes if we're not working in the community, sometimes it's not that we overlook them, but these vulnerable populations aren't front and center. But if you're out working in the community, they are front and center. Okay. Questions? Let's go through the orientation PowerPoint, and then we'll come back to the class and talk about the class. Okay. Can you guys see my screen?
Yes.
Okay. This is a new PowerPoint this term. It adds in several new slides, and I'll point that out when we get there. Some of you may already have seen it, have gone through this with another instructor, but we're required to go through this. This is our week 1. Okay, so we all know what online learning is. My suggestion with this first bullet is if you do not have a stable internet at home, my suggestion would be that you plan on going into your campus for either classes, for exams. Okay. You've got to have a stable working internet. Okay. With regards to myself and my role, we have 1 live session a week. It is Tuesdays. Okay. Tuesdays at 1 o'clock. Okay, so that's our interaction. We have an hour and a half. Okay, other than that, everything else is done through email, tutoring, Zoom, all of that. Okay, my goal obviously is to provide you all with guidance, feedback during all your learning activities. Okay, I really try and stay on top of you guys. If you're not turning in homework, if you're not showing up for class, if there's an issue with tardiness, I really, really do try and stay on top of you guys. All right. So if there are any issues, you'll be getting emails from me. Okay. And the other thing I want to mention is right off the bat is I'm super, super easy to work with. I'm super flexible. Okay. In the areas that I can be flexible. Okay. And I have a lot of familiar faces here. And hopefully you agree. I'm super easy, but you got to work with me. My primary requirement is communication. Okay, if there is anything that is preventing any of you from being successful in this class, you have got to let me know so that I can work with you. Okay, whether it's rescheduling a class, whether it's setting up a tutoring session, a study session, changing your exam date, whatever's preventing you from being successful, I implore you to communicate with me. Okay, I'll do whatever I can to work with you to help you through the situation to get you back on track again. All right, but I do beg for open and honest communication. Okay, so that's my first mantra. Okay, communication. There are assignments every week. Remember, this is a 2-credit class, so the workload is for 2 credits. Okay, and we'll get to that when we get to the modules to go over. But there are things due every week. Okay, you are required to complete every week. If you're going to be late for an assignment, just simply let me know, because I do go into the grade books on Mondays. And if I haven't heard from a student and something isn't turned in, it's a 0. Okay, if you've let me know something's going on, you need an extension, you need that 1 to 7 days, and we'll get to that in a minute, by all means, take that 1 to 7 days. Okay, but you got to let me know. Okay. You can contact me however you would like. I have completed my instructor page, which is in the module. Okay, it has my phone number, has my email. You can contact, if you're going to contact me by phone, if you're going to call me or text me, just identify who you are and what class you're in. Okay, I'm really good at getting back to people in a timely manner. Okay, you could email me through Canvas, or you can email me through the shell, or you can email me through Canvas. I'm always willing to give you feedback. Okay, feedback on your assignments, your performance in class, your participation. Okay, and remember, as you know, this is your 7th term. This is a professional setting. Communication needs to be respectful at all times. I don't typically have any issues with etiquette in the classes. If I do, I'll pull you aside and we'll talk about it. Okay. Slide 4, keep this handy. Okay. It has Dean Brown's contact information on it. Okay. So first and foremost, if there are any issues, obviously come to me first as your instructor. The second is your course lead. Okay. That's me as well. All right. So if there's something that we can't resolve, I will go right to Dean Brown and get some resolution for you. All right. So here's her contact information. So keep that handy. I sent you one of the first announcements I sent was on etiquette. Okay, so just a couple of things to remind you of. State your thoughts in courteous, positive, and respectful manner. Be mindful how you express humorous or emotional statements. Sometimes they can be misinterpreted. Keep your comments relevant to the discussion topic. Be considerate of others' experiences, feelings, and perspective. I like to ask students to share experiences in their work settings, in their communities, during class. So please be considerate of others' experiences, feelings, and perspective. Use proper language and titles. Do not use slang. Do not type your messages in all caps. This gives the impression you're yelling. Okay. Online course schedule and attendance. So everybody here today is expected to be here on Tuesdays at 1 o'clock. Okay, so we have a specific start time and an end time. The class starts at 1 o'clock. It ends at 2:40. Unless anybody has any objections, I would like to bypass the 10-minute break and go for 90 minutes. Go from 1 to 2:30 instead of 1 to 2:40. Does anybody have any issues with that? So just keep going right through and we'll be done at 2:30. Anybody have any issues with that? Okay. Course activities in this course include discussion questions. There is a project, 2 projects. One is a group, one is an individual. We'll go through that. A paper, you have a couple of case studies, 5 quizzes, and 3 exams. And remember, discussion, you should all know this by now, but discussion board, this class has 2 discussion questions, and they're in weeks 1 and 2, and that's it. So for the first 2 weeks, you have an initial discussion post due on Wednesday, right? So this Wednesday, which is tomorrow, and next Wednesday. And those are the only 2 Wednesday deadlines you have through the whole course. All right, so make sure your initial discussion post is in by tomorrow night, and then you have till Sunday to do your peer responses. And that's it for the first 2 weeks. The first 2 Wednesdays, you have something due, and that's it. Okay, I've already uploaded all the due dates in your shell, and you'll see that they're all due on Sundays. Okay, academic integrity. This is a new slide. Next couple of slides are new slides. Academic integrity, standards of student professional conduct. Okay. All incidences of academic dishonesty and violations of academic integrity will be disciplined. Right, here's some examples: cheating, plagiarism, unauthorized use of notes or materials in exams, forging assignments, unpermitted collaboration, giving or receiving aid on a take-home exam or other academic assignments under circumstances in which a reasonable person should have known that that aid was not permitted, allowing others to copy or use the work that's not your own, providing answers from grading assignments to others. Oops. Okay. Code of ethics. Okay, what are nursing codes of ethics? What is our nursing code of ethics? What's the purpose of it? Okay, these outline our ethical values, obligations, duties, professional ideals of nurses, both individually and collectively. Okay, these are ethical standards that we follow. Right? It really is our expression of nursing's own understanding of its commitment to society as a whole. Okay. Here's a really important new slide. We all have to have an understanding of this. Sites that promote cheating. Over the last 2 terms, there have been numerous students found to be on these sites. Okay. On these sites, I've actually gone to them. I have found my study guides. I've even found my exams. Okay. I've found papers, assignments. So these are getting uploaded. Okay, so sites that promote cheating, use of these sites does not promote honor, ethics, and integrity. These sites are being monitored. I can guarantee you these sites are being closely monitored. Okay, being found on these sites will place you on a heightened monitoring. Okay, for your work, for academic integrity violations. Referencing these sites or submitting work found in these sites will result in a 0 for the assignment. Second incident is going to involve course failure. Utilizing these sites, whether you're posting on them or downloading from them, are going to put you at risk for being dismissed from the program. Okay. If they're not on your list of resources in your course shell, do not use them. So here's some examples. Studako, Course Hero, Stuvia. I sent a follow-up email of additional information from Dean Brown from yesterday, and we need to clarify something. Let me go in and hang on. You can still see my screen, right? Additional messages. Okay, so here's what I sent yesterday. Okay. There's kind of a summary. Additional students using unapproved websites for research will receive a 0. Second offense, recommendation for dismissal. So here's what came up yesterday, Quizlet. I am in the process of checking with Dean Brown about Quizlet because I had several students yesterday say that they use Quizlet to put together flashcards, use it for studying, and I need to get clarification on that. So if you're a student that uses Quizlet, hang tight. Okay, hang tight till I get clarification on that. All righty. Okay. First of all, does anybody have any questions before we move off this topic? It's been a really big problem the last, I'd say 3 to 4 terms. So
Professor Marvin,
yes.
we've had instructors from online sending us to Quizlet for certain things
Okay.
last semester.
That's why I'm checking on it, Charmaine. That's why I'm checking on it. So I'll follow up with that.
Okay.
Anybody have any other questions about that? Okay, late work policy. Everybody should be familiar with the late work policy, right? It hasn't changed. First and foremost, please let me know if you're going to be late with something. Right? That's what this first sentence means, is prior approval. Okay, so like I said, if I go in on Monday and you guys haven't turned in things and I haven't heard from you, it's a 0. Once you get prior approval from me, and this is one of the non-negotiables. Okay, I can be flexible if you've reached out to me and we talk about a plan going forward for getting the work done. But if you've reached out to me, you have a week. You have that week to complete it. If for some reason you didn't turn it in and you can provide documentation, whether it's an emergency, you're not going to be subjected to the 10% deduction. Okay. But if you're just late and you're just late and you had a busy weekend or whatever, you'll have the 7 days to turn it in with the 10% deduction. But after the 7 days, I can't accept anything. And that's across the board. Okay, attendance. We all know about attendance, right? Everybody needs to sign in with their full names. Please be on time for class. Even if you get here at 1:01 or 1:02, you're still going to be docked 15 minutes. It's done in 15-minute increments. Okay, so just try and get to class on time. Okay. Yeah, we can't fudge the attendance. We get reports after each class with everybody's name, who attended, what time they came in, if they left, during class, if they left early, everything comes up on this report. And this is the report I have to submit every week to the registrar. All right, so nothing can be, if you're late, you're late. If it says 101 or 102, unfortunately with the registrar, I have to knock off 15 minutes. It's done in 15-minute increments. Okay, you need to be on camera the whole time. We should know that by now. You can't be in a car. Okay, you can't be driving, you can't be a passenger, you cannot be in a car. All right, so what I'll ask people to do is log off and log back on when you're someplace where you're participating in class. Same with work. Can't be at work. Treat it as a ground class. You walk into your classroom, you sit there, you participate for your hour, hour and a half, however. Okay? Attendance is recorded in 15-minute increments. You guys know this. Anybody who's not posting attendance for 14 days in a row, so you've missed 2 classes in a row, it's an automatic drop. Okay? If you have to miss a class, attendance taken daily in the class by the instructor, turned over to the registrar by the end of the day. Early departures, tardies, class cuts will be recorded in quarter-hour increments. Attendance records are maintained by the registrar as part of the student's permanent academic record. Students with chronic absenteeism in excess of 20% of the scheduled hours may receive a failing grade or reduced grade, a full letter grade for the course. And then this slide 13, you can review it. It goes from 5% to 10% to 15%, and then all the way up to 20%. So try to get to class on time, stay for the class, and you won't have any issues. But attendance issues build up very quickly, especially for people that are chronically tardy. All right. And by the way, everybody has a copy of this orientation PowerPoint. I sent it to you, and it's in one of the announcements. Okay, so if you have to refer back to this. Okay, anybody have any questions about attendance? Okay, so some key steps to success. Obviously, review your work that's due each week, complete the reading assignments each week, complete whatever lessons that are due, attend the live session. These are mandatory. Make sure you use your rubrics for grading, or use your rubrics for completing assignments as I use the rubrics for grading. Complete all your assignments. We don't have CJ Sims in this class. There are 2 case studies. And study and complete quizzes and exams, and we'll talk about those in a bit. Try and log on 4 to 5 times a week. Stay connected, engaged. I use the announcements all the time. All right, there's always announcements coming from me. Okay, or at least review the announcements weekly. Submit all assignments when they're due. Towards the end of the week, review what's due for the next week. Don't procrastinate. Keep in contact with me. That's really important. That's the communication piece. Have a reliable internet connection, computer, laptop. This is a tough term. This is a tough term for you guys. Typically, most of you are in 2 other classes. Most of you are in PEDS and Med-Surg too. This is a busy, busy term. So it requires time management skills. It requires good organizational skills. Okay. Try and identify a quiet workplace free from distractions to complete your work. And I would also say that for attending class. Try and be in a quiet environment free from distractions. Read all assignment directions carefully. So we're here, everybody's here today. Okay. Before the end of the week, I would like for everybody in your student resources to double check to make sure you have access to the 3 books. These 3 books should already be preloaded into your library. Okay? So in your student resources, here's your books. Right here. All right. 3 textbooks. These are all, you've used these all for prior classes. Fundamentals, Med-Surg, Introduction to Maternity and Peds. Right? So everybody should have those. Sometimes, if you are a re-entry student, you can have loaded the previous versions, the previous editions. If that's the case for you, then please let me know, because I have to send you conversion guides. And before I forget to mention, if anybody is a repeat student, a re-entry student, or has accommodations, you got to let me know. Just shoot me an email. Or you could send me a message in the chat here. So I'd like to know those. If you have accommodations, they don't automatically roll over. They have to be approved every term with Dean Brown. Okay, so send me the paperwork. Just let me know you have accommodations, and I need to get that sorted out with Dean Brown. Okay, come to class prepared to discuss the concepts. Attend additional review sessions offered by the faculty. So the quizzes that are given at the beginning of class. Okay, so the expectation is that you come to class prepared. I'm going to be sending out in the next 24 hours, hopefully, a master list of all the review sessions for the whole term. That's for exams 1, 2, and 3, and the HESI. Okay, so that's what this, attend additional review sessions offered. So our exams and we'll go over it when we get to the module, but our exams, for example, are in weeks 4, 7, and 10. So in weeks 3, 6, and 9, there'll be an opportunity to attend live review sessions from all 3 of us. There are 3 faculty in this program, Professor Kershaw, Professor Ford, and myself. We each do a review session prior to each exam, and we'll do a HESI review. Okay, meet with the faculty to discuss difficult concepts during office hours. I've listed the office hour for this class, which is an hour before the class. So if you want to take advantage of that and meet with me, please let me know. And then beyond that, I'm available to meet with you whenever. Does that make sense? It doesn't have to be during the office hour. I'm available to meet whenever. Honestly, evenings, weekends, during the day. So you just need to let me know. Schedule tutoring sessions when needed. If you're having technical difficulties logging in, you'll have to contact technical support, which is in your student resources. Let's see. Let's skip over that one. Tutoring. So I'm available for tutoring. Okay. The way I utilize tutoring is, let's say you want to have some tutoring before an exam. Okay. I'm hoping, but my expectation is that you have studied to the best you can. You have watched the review, either attended a review session or watched the recordings. And when we get to our tutoring session, we're reviewing the concepts that you're having trouble with. Okay, we're not going over everything from A to Z, or if you missed week 2 class, we're not going to have a tutoring session about everything you missed. You're going to watch the recording, you're going to go through the concepts, and then we're going to talk about the concepts that you're struggling with. Okay. I'm going to skip over the grading component, because I want to go through it in the syllabus. I will turn on homework grades in week 6. Turning on homework grades lets you know what your overall score is or how your homework's affecting your overall grade. So if you're turning in your homework on time and you're doing a good job, it's going to increase your grade. If you're not turning in homework, it's going to decrease your grade. All right, this is not a class you want to take a homework fail on. Okay. And everybody knows the rule of thumb. You have to have after all your KGAs in this class, we have the HESI 3 exams and 5 quizzes. You have to have a 78% before your homework kicks in at the end. Everybody knows that. And that's in the syllabus, and we'll go through that. So when you take your exams and quizzes, you have to have your 2 devices, right? You have to have your laptop to take the quiz or the exam, and then your phone to be on Zoom. Right? So try and remember that both are fully charged or on a charger. If you go off camera while you're taking the exam or the quiz, it's going to be a 0. As KGA assignments have to be proctored, quizzes included. Quizzes are part of KGA and will be completed in class with a proctor. Okay, quizzes are designed to be given at the beginning of the class to allow faculty insight as to the concepts students are struggling on. Right, it requires that you become prepared to class. It's just one attempt on the quiz. We'll take it at the beginning of the class, 15 minutes, and then we'll review it in detail. We'll go over why the correct answer is correct and why the other one's answers are wrong. We spend a lot of time going through quizzes. Students find that helpful. Okay? You got to take your quiz on camera. Exams are still through ExamSoft. You'll be able to download the exam an hour prior to. We have lots of additional questions for this term for exams because we build our own. All right, so exams will be looking way differently this term since we're going to have lots of different other questions to pull from. And the other thing too about quizzes, they're going to look different. All the quizzes have been updated with questions. So all the quizzes are going to look differently this term as well. All right, so let's see. That's all about the exam, which we don't need to know right now. 1 attempt for exams. Obviously, if we're having issues, you got to stop and let me know, but we'll review that before week 4 or prior to the exam. Accommodations, you got to let me know about accommodations this week. All right, I have to make sure that's all set up for you with regards to your quizzes and exams. Okay, this is important down here, this last bullet. I don't have any problem with any students taking their exams on campus. Okay, I have every term, students take their exam on campus, but there's some responsibilities that go with that. Okay, you have to find a proctor. Once you submit that proctor to me 72 hours prior to the exam, I'll reach out to that proctor, copy the dean on that email, make sure we have approval from the dean for you to have your exam proctored by whomever. And then I will reach out to that proctor to provide exam information, passcodes, all of that. Okay. So again, I have no problem with anybody having exams proctored on campus, but there is some legwork that you guys need to do. And it has to be done at least 72 hours prior to the exam. You guys know all this. As far as exams, be asking for an ID, piece of paper, whiteboard, ask you to give me a 360 view of everything, or of your desktop. Can't have any earphones in. So that's pretty standard. I'm just going to do a quick check here. Everybody doing okay? I apologize if you've heard this. Jay, are you around? I can't, it's a blurred screen. Where are you? Still
Professor
can't.
Mark,
There you are. Go ahead.
With our exams with our class actually being like an hour and a half, how long do we technically have for lecture after our exams are done?
We don't come back. We don't come back after exams. This is a short class. And I typically have people with accommodations who will take up the full hour and a half. So we don't come back after exams. I know some of your other classes you do. This class, we do not. Once you show me that green check mark screen, you're free to go.
Okay, thank you.
You're welcome. Okay, I really need everybody on camera. I don't want to keep repeating this, but it's a requirement. So please, if you're not on camera, get on camera. Thanks. Okay, we're getting close. So that's your IDs. Proctored, missed exams. Okay, again, if there are issues going on that is preventing you from being successful, like taking an exam, you got to let me know ahead of time. Okay, but plan on, if you're missing exams, plan on providing documentation. Okay, providing documentation will give you the additional week to schedule and take the exam. If you're missing an exam because of personal reasons, you got to let me know. And you can take it within the week, but you'll have a 10% deduction. It's treated just like the late work policy. Okay. Again, contact your instructor with issues that may prevent you from being successful before you take the exam. If you take the exam and you've done poorly because of whatever is going on, okay, I can't do anything if you've already taken the exam. All right. I want you to be successful, right? It requires communication. Okay. Quizzes we talked about. All the quizzes are unpublished for right now. We'll publish them the day that we're taking them. So before class, I'll go on and publish the quiz. Okay. Okay. Are you guys hearing background noise? Okay. Hang on 1 second. 1 second. Let me just mute myself. Okay, sorry, that was Tom. He was on the phone having quite a loud conversation. So, okay, to keep going here. We'll review exams. Obviously, this means if you're having technical issues, stop the exam, let me know, we'll figure things out. We don't need to cover that right now. You have a HESI. Okay, your HESI's given in this class, it's one attempt. Okay, it's given in a proctored environment. You guys know the drill. You've been already doing HESI's. Everybody in these campuses will do HESI's on campus at the end of the term in week 11. As it gets closer, I'll provide you the schedule of days and times, but I don't usually get that till week 8 or 9. Okay. HESI, here's your remediation. I'll provide this to you again before you take the HESI. This is the required remediation hours based on what your HESI score is. Same security. ID, on camera at all times, visible at all times. Again, a communication, contact me if you have any problems or if you would just like some additional help. Homework assignments. There's rubrics to every homework assignment. Okay, I assume that you are already doing all of this to be successful, planning your time, prioritizing, completing your work, submitting your work. Okay, and you can read through this. This is slide 41 if you need a refresher. Whatever your organization, this is just a sample of schedule however you need to organize your time this term. This is a tough term. There's a lot going on. Your other two classes most likely have clinicals, sims, and labs, correct? This class does not have those, but it's going to take coordination, time management, and organization. So however it works for you. I used to use a calendar like this. I put everything on my phone now. My phone calendar is my calendar. So whatever works for you. Everybody has their own organizational strategies. Okay, this is the late work policy. We've already covered that. NCLEX. Okay, here's my mantra on NCLEX. Okay, anytime you can have an assignment that provides rationales, I find rationales to be an extremely good learning tool. Okay, these 4 NCLEX assignments aren't just a blow through, get them done in 10 minutes, 15 minutes, and submit it. Okay, please take the time with your NCLEX assignments. These are practice for your NCLEX. Okay, let's say you start your NCLEX and the first time out you get like a 25. Take the time to read the rationales of the questions you got wrong and then redo it. See if you can get up to 35 or 40. I tell students to try and submit between a 45 and a 50. That tells me that that assignment was productive for you. Okay, if you submit me 25s and 30s, you probably haven't got a whole lot out of the assignment. Does that make sense? There's a reason there's 4 NCLEX assignments. Okay, we want you to practice, practice, practice. And speaking of practice, in your student resources, there's a couple of things I want to highlight in your reference package that students have told me it's very helpful. One is this, the third one in, HESI, Comprehensive Review for the NCLEX PN examination. Here, practice questions, practice quizzes, practice tests. Okay? And the second one is down here, Saunders Comprehensive Review for NCLEX PN examination. Okay, so these are resources I would encourage you to take advantage of throughout the term. You know, I have students tell me that they do 100 practice questions a week, or 25 extra practice questions a week, or 50, whatever. But know that these are sitting in here in your reference package, and they're excellent, excellent tools. Okay? Did you guys know you had those? Do you guys take advantage of them? I'm just going to get a visual here. Do you guys know you have these resources?
Yeah.
Do you take advantage of them?
Yes.
Are they helpful?
Very.
Yeah, they are. Okay, Jay, I still can't see you. Sorry to keep calling your name out, but I still, there you are.
Do you mind if NCLEX questions is submitted prior, like a week prior?
Okay, good question. Work ahead. I haven't locked any assignment. Here's what I would suggest. If you do the weeks that you have your NCLEX questions, 3, 6, 9, and 11, when you pick out your categories, and it's all in your module, what you pick out, pick this, pick this, pick this. Right. Those are related to the concepts we're covering. So if you want to work ahead, that's fine. But my suggestion is don't submit it until the week it's due.
Okay.
That's my suggestion. All right. Just in case the week we cover the concept information, you want to go back and do one last try and see if you can get a higher score. That's my suggestion. I don't mind if anybody works ahead. However, 2 things. Make sure you're updated in all of your classes. All right. Don't spend the weekend doing all your community assignments. Okay. You got to be able to balance these 3 classes. Work ahead if you feel like you're caught up. But don't work ahead just to get it checked off or get it out of the way. That's not going to help you. Make sense?
Yeah.
But I haven't locked any, I know everybody does it differently. If I'm concerned about working ahead, let's say you're behind in this class, but you're still working ahead, I'll probably send you an email and say, hey, let's get on Zoom real quick and talk about you working ahead. Make sense? But I haven't locked any assignment. All right? Okay. All right, we're getting close here. So I want to get to the syllabus. You all know where to find your NCLEX, right in your module, right in your weekly module. Here's what you click on, the categories. It's all lined up for you. And I do check those when I check your NCLEX, when you submit your NCLEX. And the other thing, remember, is every assignment start with the link in your module. Right? Because if you go to do an NCLEX, let's say you go www.elsevier.com. You're not going to be able to get a PDF to submit. It's going to be a screenshot, and I can't accept screenshots. NCLEX we just talked about. I can't accept screenshots.
Professor, I have a question.
Yep, go ahead.
What if we can't access our Sonder? Because I keep getting that pop-up that says not authorized.
For which one?
Or when, like, for Saunders assignments, and we would go to student resources, right, and click on the little Saunders link to take us to the website.
Here?
Yes, that when I click on that, it says not authorized when it takes me to the page.
Is anybody else having that issue? Let me
No, I
know.
just used the one in the modules.
You what?
I used the one in the modules.
Okay. Julia, try that one. Try and go through the modules, student resources, and let me know.
Yep. Module student resources, and I click on
Saunders.
Saunders, and this is what I get. Sorry, let me change the screen.
Has anybody been able to get into the Saunders through your module? Or is anybody else having access denied?
Here you go, Professor.
Okay. And is anybody else getting that screen?
No, but I did get that before. You might have to contact support though, because it might be something with your computer time zone.
Okay.
Like they have to like
Julia,
switch it.
by any chance, are you a re-entry student?
Re-entry,
It might need to be reset.
Oh, yeah, maybe.
Does that make sense? It may need to be reset. Are other people getting in?
I got in fine.
Okay.
Okay.
Julia, you might need to put in a ticket for that and have it reset.
Okay.
Jalila, try through the modules for the weekly assignments on week 3, go down to assignments and it has a link there. See if that works for you.
All right, you guys, I'm going to keep going. Okay, HESI, we don't really need to talk about right now, other than you have the resources and student resources. Okay, we don't have any CJ Sims. Papers, we'll talk about rubrics and questions at the end of the term, which you can review on your own. Okay, so let's jump into the syllabus. I want to review just a couple of things on the syllabus, and then we'll talk about the class in general. So here's your syllabus. Okay, we've already talked about course description, right? Wellness promotion, we'll be covering wellness promotion, independence, interdependence, discharge planning, chronic illnesses, HIV, healthcare delivery in environments out in the community. Okay, you can have a look at the student learning outcomes and the course objectives on your own. Let's see. Instruction methods we've talked about. Here, this is listed again in your syllabus. Your 3 books here. Ignore number 4, the 4th bullet, because we don't do CJ Sims here. There's your
Professor?
Yeah.
Sorry. On the other, on our student resources page, it says it's a DeWitt book, not the Williams or Strongberg. Is that a different book than these two?
Let's have a look.
The one, it was when you first pointed those two books out. See, it says DeWitt for both of those. And then when you go back, it says Williams and Stromberg for ours that we used in class.
Okay, this is your student resources have the updated books. These are your
Ours are-
updated books.
Ours are like edition. They're the same editions, but they're from different authors. It's like a revised
Yeah,
reprint.
I
and
know. I think
fundamentals.
these two DeWitts
then-
are incorrect.
Okay.
Okay. Let's see. Let's pull this up. And I don't think this is, let's see. Let me double check on this, okay? But these are the books, your syllabus books. These are the books you should have. Okay? Do you guys have these loaded into your library? Williams, Stromberg, and Leifer. Yes?
Yes.
Miss
Yes.
Marvel is, even though it says that those Williams, Stromberg, and Leifer, it
Mhm.
still has DeWitt on the actual book. Let me show you.
Okay. Does it, which one are you showing me?
This is the fundamental concepts of
Okay.
skill.
It has DeWitt, but does it also have Williams?
Yes.
Okay, okay, all right. So, okay. So we are talking about the same. Yes, you have these are the correct books.
Yes.
What should be done is in your student resources, that should be updated. So I'll take care of that. I'll make sure that happens. But we all have the same books.
Yes, ma'am.
Okay, all right, all right. Okay, there's your package, reference package. We talked about this one right here, right? As a good resource that you all know about. We talked about this one. Okay, and I would actually, this one is an excellent one too. Strategies for Student Success for Next Gen, for NCLEX. That's also a good one. Okay, so you've got third one down, 4, 5, 6, sixth one down, and seventh one down. And the other thing too, that if you struggle with math, I don't know if you guys have accessed your Calculating with Confidence. That's a really good resource as well. Okay. Want to go over what our grading component looks like. So you have 3 exams, right? Weeks 4, 7, and 10. Each of them, the total is 55%. The other 5% comes from your 5 quizzes. Okay, those quizzes, we'll go through the modules, but they're in weeks 2, 3, 5, 6, and 8. Each of them are worth 1%. And then you have your 4 NCLEX assignments here, weeks 3, 6, 9, and 11. Each of them are worth 1.25% to get to 5. You have a vulnerable populations project, which is due in week 10, worth 5%. You have a HESI prep assignment due in week 9, which we'll go over, worth 5%. And then you have 2 case studies. Your case studies are in weeks 4 and 9. Okay, and then you have your discussion questions, group project that are pass-fail. Okay. So that's where I want to go. Oh, no, I actually want to go over and show you the course outline. So the left side are the concepts to be covered during each week. The middle column are the readings and the student learning activities to support the concepts. And the far right-hand column are assignments due. And in each of my weekly announcements to you, I literally copy and paste this information in there for you. Okay, so just here's an idea of the things we're going to cover over the term. Introduction to community nursing, levels of prevention, that's your primary, secondary, tertiary. In week 1, we do an introduction to healthy people. So here's the website to go on. We do an introduction to vulnerability. And by the way, next week, I'll be covering week 1 and week 2 concepts. Okay, so you won't be behind. Next week, we're going to cover school nurse, growth and development, common childhood ailments. And actually, your discussion question next week is common childhood ailments. Family nursing, family health risks. Now remember, in your readings, let's say you have a whole chapter. Since this course uses 3 books, you do have in some weeks full chapters, like you have the fundamentals chapter in week 1. There will be a PowerPoint for that in your reading overview in the module, right? But in your Med-Surg book, you're only required 1 page. So you're not going to have a PowerPoint for that whole chapter. Okay. Next week, for week 2, you have all these pages for these certain common childhood ailments, right? So you're in 1 book, you have certain pages, and that's why you don't have all these PowerPoints, because you're not responsible for the whole chapter. But you will have PowerPoints in your fundamentals for weeks 11 and 12, since it's the whole chapter. Does that make sense?
Yes.
There's a variety of kinds of reading assignments. You may have a whole chapter. If you do the PowerPoint, there'll be a link to it in your module. You may just have certain pages, and that's all you're responsible for, certain pages. If it says see Canvas course, see that? Has anybody found where those readings are yet?
In the
They're right.
modules.
They're right in your module. They're right in the module. And I'll go through that when we get to the module. Okay, so if it says see Canvas course, that's built right into your module. Okay, so weeks 1 and 2, we went through the top concepts. Weeks 3, we're going to talk about special vulnerable populations, specifically migrant farm workers, rural populations, homelessness, and poverty. Again, we're building our knowledge base for community nursing. These are all vulnerable populations you'll see in the community. So that's the first third of the class, and then we'll have our exam. And then weeks 4, 5, and 6, we'll cover more special vulnerable populations. We'll cover pregnant adolescents, LGBTQ, mental illness, alcohol, tobacco, and other drug problems. And as you can see, you have your readings. So it's a full chapter 47, full chapter 48, full chapter 11, full chapter 41. So you have all those PowerPoints, right? Since they're full chapters. And then in this book, you just have a few pages. So you won't have the PowerPoints for that because it's not a full chapter, right? And then you have some Canvas course reading, which is in your module. Then we'll cover hospice and palliative care, death and dying, faith and spirituality, and ethics. Week 6, we start to talk about specific roles of a community health nurse. So occupational health, the occupational health nurse, the environmental health nurse. We talk about barriers to learning, reinforcing health education. And then that's the middle portion, weeks 4, 5, and 6. And then we'll have 7, 8, and 9. We'll talk about infectious disease prevention and control. We'll talk specifically about HIV, TB, STDs, bioterrorism, and disaster. And then week 8, we'll get into home care, community resources, case management, care of the complex chronic illnesses that we see frequently that are common in community health. And then our last week, in week 9, we'll cover human abuse and violence, cultural influences in nursing. So it's a wide variety of topics that we'll cover. Okay. There's a couple of Hang on
So
a
we still have a
second.
quiz next week, as the syllabus
So
says?
we're gonna get there now. So as far as modules, there's a couple things I want to point out. Your quizzes are gonna be in weeks 2. So your quiz for weeks 2, your quiz 1 and week 2 will cover weeks 1 and 2. Right? Then your second quiz, which is in week 3, will cover week 3 information. Okay? Then we'll skip and have the exam. So in week 5, which will be quiz 3, will cover weeks 4 and 5. Quiz 4, which is in week 6, will cover week 6. And then quiz 5 in week 8 will cover week 8. So it's a cumulative, you're taking your knowledge forward. So when you prepare for class, on any given week, there's a quiz. That's the information you're expected to know. I just want to show you, if you go through each module or each week module, the first part of it shows you the course objectives and it shows you the concepts that we're covering. Okay. Second page of your module is your readings. Okay, and here's where you'll have your links to your PowerPoints. Okay, so chapter 1 in fundamentals, here's your link. Here's the website link to your Healthy People 2030. And then here's your Canvas courses, Canvas course readings. So you have to actually skip through. And then here are your Canvas readings. Introduction to Community Nursing. All 4 of them just right in a row. Levels of healthcare prevention. So they're all built right into your modules. Does that make sense? Okay, just want to make sure you know where to find them. There's some assignments I want to point out to you. Okay, week 7, please take notes on this. Week 7 is a group project. By weeks 3 or 4, I'll send out the groups. I try and keep them within campuses. All right, so week 7, you have an infectious disease group project. Okay, you'll be working in groups. I'll assign you an infectious disease. Okay, and this is what you need. You look at the rubric, and this is what you need to all come together and do a paper and submit it. There's 5 different sections of the rubric, so somebody will need to take the lead and send out an email. We've been assigned pertussis. Which part of the rubric do you want to complete? Do you want to do the introduction and history? Do you want to do who's affected? Do you want to do symptoms pathology? Do you want to do cure treatment for the disease? You want to do how is a person's daily life affected? Okay. So have a look at that. You don't need to worry about that yet, but I wanted to point that out to you. Okay. The next thing I want to point out is in week 9. Okay, this is something I want you to save to your desktop today. Okay, it's called the HESI Prep assignment. It's in week 9. Okay, this is a blank document. Got to download it. This is a blank document. This is a work in progress through your whole term. Oh. Okay. So this is called HESI Prep assignment. This is you're building towards your study guide for your HESI. This is an ongoing, save this to your desktop. To complete this in week 9 is going to be time consuming and difficult. This is why I want this to be a work in progress, because eventually what you're doing is you're building your study guide for HESI. So you're going to get out of this what you put into it. Make sense? All these boxes are all different concepts we've covered. Okay. So I've looked back at the HESI. I don't know what questions they're asking on the HESI, but I know what topics are being asked. So these boxes represent the topics being covered. So for example, anthrax. There was a question on the HESI about anthrax. I don't know what the question is. But we do need to think about what we need to know about anthrax incubation. And if you look at the next gen format and the format of the HESIs and the NCLEXs, these are clinically based questions, right? So it's how do you take care of somebody with anthrax, right? So if you look at the directions, it says, as you complete the assignment, please keep the nursing process in mind when addressing each topic, right? Each topic requires your critical thinking skills, how to apply it from assessment to evaluation, which is the nursing process. So if you look at anthrax incubation, we'll cover that when we get, I think it's in week 8, when we get to bioterrorism and disaster. But what do we want to know about anthrax? We probably want it from the nursing process. We probably want to know what might a patient present with, right? I'm thinking nursing process. What are we going to assess? How is it transmitted? How is it treated? What's the patient education that goes with it? Right? And you follow that same train of thought for all of these. So after we go through disaster in week 8, what are the levels? What are level 1, 2, and 3 disaster phases? What's disaster planning? What does that mean? What's red tag triage? Okay, these are questions. Each of these boxes represents a question on the HESI. What they're asking, no idea, but we need to be familiar with these topics. Does that make sense? So again, if you save it to your desktop now, each week we cover certain topics. You can go in and fill it out, right? And that way, when you get to week 9, it's completed. All you have to do is submit it. And I'll try and remind you weekly or every couple of weeks, go back to your HESI prep, fill in what you can. There may be weeks that there's nothing you can fill out, but there are certain weeks there's a lot you can fill out after class from your notes, your book reading, and lecture. Okay? The last assignment I want to point out is in week 10. It's called your Vulnerable Populations Project. This is also worth 5%. This is an extension of your week 1 discussion question. Your week 1 discussion question was pick a vulnerable population. What services do you have? What do you not have? This is an extended version of that. Okay? So you are going to pick a vulnerable population. I'm telling you about this now so you can get going on it if you want to. This is a PowerPoint research project. It's worth 5%. Okay, so what you're doing is you're picking a vulnerable population in your own zip code, and you're doing a research paper. Okay, and here's the outline. You can read through it. Population description, health risks, resources, service gaps. Okay, so I point this out now because as you can see, after week 8, it gets really heavy. Okay, so I want you to get working on these projects. The sooner the better. So in week 9, you have your HESI prep due. In week 10, you have your vulnerable populations assignment due. Week 10, you also have an exam. Then you jump right into week 11, which is your HESI. So my point is that it gets busy towards the end. So any spare time you have to work on some of these big projects, get going. There's one other thing I want to point out in my announcements. I know I sent you guys a lot of announcements. Math resources. I put all the math resources I have together into one announcement. I did receive a message from a student that a couple of these, I have to go back and look, but a couple of these she said she wasn't able to open. I think it was in here. I don't know. Has anybody taken a look at these yet? Let me know if you're not able to open. I would highly recommend Professor Bogart's math tutorial, that middle one. Okay, it's really math 101. And there's 5 math questions on each of the exams. They're basic questions. Basic math questions. But I want to point out each week you're going to get a weekly announcement from me. So for example, week 1. Okay, at the bottom, don't anybody overlook this. At the bottom of every announcement is an attachment called PNR week 1 or week whatever, blueprint concept. Blueprint concept. That's our lecture notes. That's our class notes. That's what we're going to be covering. So if you hadn't had a chance to look at it, I just want to pop open week 1. Okay, and here's where I told you I copy and paste right from the syllabus. Concepts, which are in the left-hand column. Readings, I copy and paste right from that middle section. Okay, and then I go through each of the concepts and do weekly notes. So it's all outlined for you. Okay, so as you prepare for class, I would highly suggest you do your readings and you review these weekly notes. If you do both of these 2 things, you'll be prepared for class. You will get weekly notes every week. Week 2, week 3, week 4, week 5. So don't overlook those. So you'll get an announcement from me every weekend. It talks about what we're going to cover this week, the concepts, your readings, and then anything that's due, I put in this little middle section here, and any reminders for you. Okay? So I think I have it pretty organized.
I have a question. The math resources, I just saw it says access denied when I clicked on it.
Which one? Which one?
So I clicked on the first 2. It says dosage calculation. When I click that, this is what's coming up.
Okay, access denied. Okay, is everybody getting that? Jay, quick question. Are you in the car? Jay?
It's 2:30 and class is over with. Am I able to go?
No, are you in your car? I guess is what I'm
It's
asking.
2:30. Am I able to go?
I'm not done with class yet, no.
Okay.
I'm almost done. I'm almost done. But my question is, are you in your car?
I understand that, but you said that we were going to bypass the 10-minute break. It's 2:30 now. Am I able to
Okay.
go?
Okay, no, not yet.
Okay.
Lisa,
Yes.
access denied on the top, on all of them?
Yes.
Oh, okay. All right, I'll have to is everybody getting the access denied? On your math resources? No, Lara, we'll be taking, we take my computer battery is low. Okay. We take the quiz at the beginning of the class. We don't wait for me to go over everything. So your preparation of weeks 1 and 2, you'll be taking the quiz. And we cover the content after. The expectation is that you're prepared for class.
So we today was just to go over the
Yep.
like the orientation of the class and
Right.
the syllabus
So
rules.
if you do your
read.
if you do your readings for week 1 and review the notes, and then this weekend you review your readings and week 2 notes, that's what you'll be taking the quiz on at the beginning of next week.
So would that would be for every quiz? Like we won't be going
They're
over
done. They're done at the beginning of class, as the expectation is that you're coming to class prepared, having done the readings and reviewing the notes.
So we won't be going over like for week 2. We'll be going over week 2 after the quiz. Like
We'll be doing weeks 1 and 2 content after the quiz.
after the quiz.
Yeah.
Okay. Okay, I understand. So we won't be going over the contact prior
No,
to
no.
no class.
correct. For all the quizzes. Yep. That's why we want you to come to class prepared. That's why it's given at the beginning.
Okay.
Yep.
I'm just trying to understand.
Yep.
All right.
Yeah,
Just go ahead.
yeah, I'm getting the same thing. Access denied.
All right. I'll have to sort out the math resources. I think I might have to send them one at a time.
Thank you.
Or one block at a time, but I'll sort that out. I thought it was easier to send them all together. Does anybody have any general questions for me to answer? I will stay on after, if anybody has any specific questions, but does it?
Because it was really.
Pardon me?
For the exam, will you give us like an exam review paper, or would that be, how would the exam reviews
Yep,
be?
I will be sending out an exam review document to you guys this week. And basically it simply lists out all the concepts that we're going to be covered, and you'll be creating your own exam study guide from the lectures, from the notes, and from the readings.
Okay.
Okay, I'll be getting that out this week.
Thank you.
Okay.
Okay, Professor Marble, I want to stay after class.
Okay, that's fine. Does anybody have any general questions that would help everybody else out?
Yeah,
with our-
Professor,
Go
I'm not
ahead.
sure if you answered this question already, but for our quiz next week, I'm assuming it's at the end of class because it goes over chapters 1 and 2. No, it's in the
No,
beginning.
it goes in, I just reviewed that. We take the quiz at the beginning of the class. So,
Okay.
that's the way all the quizzes are done in all the classes. Okay, that's the way quizzes are.
And what is quiz 1 gonna be on if we're not going over chapter 1 and chapter 2 after the quiz?
You are reviewing chapters 1 and 2 with your readings and with your weekly notes. That's your preparation to take the exam.
So we're gonna take the quiz and then you're gonna teach it.
Correct.
Oh, okay.
Correct.
So if we have any problems, we have to email you or call you and get that solved before our quiz day, right?
If you have what kind of issues?
Any issues, or like we don't understand a process of what
Yeah,
we're
yeah.
trying to read, we can
Yep.
get it on. So if
Yep.
we have any issues, we
Yep.
get you first.
Quizzes given at the beginning of the class are standard throughout the program. That's not my rule. That's the standard. We give them at the beginning of class. Anybody else have any questions that
And
would
as far
benefit?
for like exams, do we have access to the other professors who are doing
Yep.
like live review exams as well?
Yep, I'll be sending all the everybody will be you'll get 3 recordings. You'll have 3 opportunities to attend 3 live reviews, and then you'll have all 3 recordings. Now, if nobody shows up to the exam reviews, we don't do a review. And that happened a couple of times last term where there was only 1 recording. So, but if people show up, we do the review. But if people don't show up, we don't do it. And I'll be sending you that full term schedule. Hopefully in the next 24 hours. I'm waiting for one more professor to get me her dates, but it's almost ready to go.
Is the Healthy People 2030, is that just for like the quiz, or is that on the exam as well? Because there's like a bunch of topics on the website, so I'm just want to make sure I go over the correct material.
Yep. Healthy People 2030 is on the exam, and won't be on the quiz. But there'll be some questions on the exam. Okay. What else? All right. It's good to see everybody. If you have any questions, reach out to me between now and next Tuesday. Everybody's excused to go, and then I'll stay on for any specific questions. Okay? Nice to meet everybody.